So, good afternoon, and our final speaker in this session is Kate Kennedy, and Kate is a student of the BSc in Psychology. So, you're very welcome, Kate, and we look forward to hearing about your research.
Hi everyone, my name is Kate Kennedy and I'm a final year student at the University of Limerick and I'm studying psychology. I'd firstly like to take a moment to thank you for the opportunity to share the research I've been working on for the past year with you all. My final year project investigated the association between social media and depression during the first COVID-19 lockdown in Ireland and whether social connectedness mediates this association. So for clarity, when I refer to social connectedness, I'm referring to the feeling of belonging to or closeness with a group or network. Social connectedness is acquired through recent social interactions, and it is a basic human need which allows individuals to feel part of a community. So how is this relevant to the association between social media and depression? The association between social media and mental health has been investigated thoroughly since social media has become so central in most people's everyday lives. Even though there is an abundance of research regarding this topic, it is inconclusive whether social media is beneficial or detrimental for mental health. Some research has found cyberbullying, social media addiction, social comparison through social media, and passive social media use, such as scrolling, can be psychologically damaging. However, other studies have found routine use of social media can improve mental health, and social media can facilitate social interactions and offer entertainment and humor for people experiencing depression. Investigating whether social connectedness is a mediating variable for this relationship could fill this big gap in research. And for clarity, when I hypothesized social connectedness as a mediator of social media and depression, I mean, social media and depression do not have a direct relationship, but social connectedness could be a third variable which explains this association. Though social media's main purpose is to create connections and socialize, social media has been found to reduce offline social interactions and therefore decrease social connectedness. And particularly, excessive social media use has been found to decrease any benefits of social media on social connectedness. Low levels of social connectedness has been linked to depression, and due to these findings, I thought it necessary to investigate social connectedness as a mediator between depression and social media's relationship. Also, it has been established increased social connectedness with family, friends, and colleagues has been linked with a positive association with well-being and during the COVID-19 pandemic, and it was found in 49 different countries. So this research can also give us insight into how COVID-19 and its restrictions affect behaviours and our mental health. And this is kind of important because our mental health is already vulnerable during these unprecedented times. And so understanding what behaviours could benefit us would be incredibly valuable. So how is this research carried out? Convenience sampling was used to enrol participants, with the voluntary survey being advertised through Instagram, Facebook, and the University of Limerick's mailing list. This study was based off data collected in a larger study which focused on COVID-19, mental health, and other variables. There was 652 participants, with the majority being female and Irish, and with a mean age of 29 years of age. The survey was conducted through Qualtrics research software, and participants completed the survey over the course of 3 weeks, from April 17th to May 11th, 2020. Participants completed a survey and self-reported demographic questions, as well as the Patient Health Questionnaire 9 to measure their depression levels. They were also asked to report how many hours of social media they used daily in the past 2 weeks, as well as filling in the revised social connectedness scale to measure social connectedness, which contained questions such as, how close do you feel with others and the world at the moment? IBM SPSS was then used to complete statistical analysis. From regression analysis, it was found social media was a positive predictor of depression, which means the more social media was used, the more depressed participants were. Next, a mediation analysis was conducted, controlling for potential confounding variables of gender, age, and previous mental health conditions, and established social connectedness as a partial mediator of social media usage and depression's association. As you can see from the diagram, social media's relationship with depression is not completely direct, but mediated by social connectedness. Higher levels of daily social media usage predicted lower levels of social connectedness, which in turn predicted higher depression. Or in other words, the more participants used social media daily, the less socially connected they felt, and therefore the more depressed too. At the moment, the discussion section of my final year project isn't completely finished, but I will briefly convey the main implications of this research. Social connectedness was found to mediate social media and depression's relationship, which is a major finding in this research area. This knowledge is both useful for anyone researching mental health, social media, and COVID-19 restrictions, as well as valuable for the general public to understand the implications of our social media habits and how this is connected to social connectedness and depression. This research did have some limitations, which I think the main limitation was it was conducted entirely online and through self-report surveys, which allows for human error, and it's based on participants' own perception. However, with the context of COVID-19, I think it was the only safe way of collecting this information, but future research could use apps on participants' phones to track a more precise number of daily hours participants spent on social media. More future research could investigate whether there is a difference in offline and online social connectedness and how social media use affects this and what effects they have on levels of depression. More research could also look at how we are using social media rather than just the amount of time that was spent on it. Perhaps this finding, which people who spend less time on social media are better connected because in the limited time they spend using it, they are more socially productive, helping their offline connections and not just passively using it, such as scrolling through their news feeds. It is clear social media was a hindrance to mental health during the first COVID-19 lockdown, and it is valuable to understand this and use this knowledge as we are still facing extended lockdowns in Ireland a year later. However, it would be interesting to investigate these same variables when the pandemic is over to explore whether disaster situations affected how we use social media and whether the same effect would be found between the three variables. Thank you for listening to my presentation about my final year project. I hope you enjoyed and learned something new. If you have any questions, feel free to ask, and I've included a few references in the next slide that I mentioned earlier.
Wonderful. Thank you very much, Kate. And we certainly did learn from it.